There were genuine and deep-seated concerns over the NHS reforms. That's what the experts who were asked to advise the government on where it had all gone wrong have concluded. Their report has called on the coalition to make significant changes to their reforms of the NHS in England. It'll certainly give GPs more control, but how things will change for patients? Our health and social care correspondent, Victoria Macdonald's been finding out.
This is where and what it's all meant to be about, the GP surgery, this one in East London, and the patients waiting to be seen. But for all the big plans and promises of reforms to the NHS, everything has been on hold because of fears the politicians had got it all wrong.
But the principles behind the reforms have always remained the same, and nobody's ever really disputed them, and that is that GPs should have more power to provide better treatment for their patients. And in turn, their patients should have more choice about which hospital they go to or even which doctor they see. Yet somehow that's all become lost in the controversy surrounding the NHS bill itself.
And today the forum set up to advise the government on how they could get back on track on what changes needed to be made to make the NHS health and social care bill workable, reported back.
I've heard about how we can make these reforms better.
If there was any doubt about the level of concern, the numbers say it all. The forum of experts met with nearly 7,000 people over the space of 2 months and received more than 29,000 emails and letters. Many of the 16 recommendations were as expected. There's lots about transparency, accountability and choice. But there are some important changes. GPs should, they say, include specialists and nurses in deciding what care to buy. The duty of the regulator monitor to promote competition should be removed. It should focus, they said, on choice and how the care is delivered. And the government should not increase the role of the private sector as an end in itself, and there should be no cherry-picking of patients by private providers.
And what the forum is recommending first and foremost is to emphasise coordination of care, GPs working with hospital specialists, health and social care working together around the needs of patients.
But the forum did say there had been genuine and deep-seated concerns that the coalition's plans for the NHS would leave it fragmented and privatised.
So this all comes back to the accusation, the central accusation, that this was a very badly drafted bill.
Well, I think the key principles underneath the bill of patient-centredness, of clinical leadership and improving the outcomes of clinical care are absolutely sound. I think some of the messages have got lost in translation, and I think how the bill is written, particularly in the area around monitor, needs to be changed.
Back in the East London surgery, Dr Ken Aswani has always supported the reforms, and now he says he wants to get going.
We wouldn't want further delay in the implementation of the reforms, because I think the patient benefits are much more urgent, and we should be getting on with them.
But will patients see a change soon? Perhaps not. The bill may have to be rewritten, although the government is expected tomorrow to accept most, if not all, of today's report.